come up as the next speaker. Wendy is a registered nurse. She is the chair of the Australian Day Surgery Council, and she has been instrumental in setting up several and managing several day surgery centers in Australia.
Good morning. On behalf of the many Australians here, I would like to thank our hosts here in Hungary for all the hard work that has occurred to provide such a full and exciting program. We know from our experience in Brisbane in 2009 just how much work it takes to put such a program together. Meanwhile, I'm delighted to provide a brief overview of day surgery in Australia. Australia is a very large country with a very small population. The people this increase continues because of migration, but interestingly for some of you, we did have an initiative from the Australian government a number of years ago that families were to try and have 3 children each. One for the mum, one for the dad, and one for the country. As a result of that, there have been some significant baby bonuses. The average weekly wage in Australia is $1,333.40, or in euro, it's about 1,046 euros. 5 to 6% of the household expenditure is spent on Medicare and health expenses. In 2011 to 2012, we have 1,345 hospitals, and they comprise of 736 public acute hospitals, 17 public psychiatric hospitals, 307 private freestanding day surgeries, and 285 other private hospitals. All of these hospitals do have patients on a day surgery basis. Over and above that, we do have unregistered facilities, a little bit like what Arnie was saying with the office-based. We do have facilities that provide cosmetic or dental procedures under IV sedation and general anaesthetic, and they are not reflected in these figures because they don't get funding from the government. And interesting, it was also noted that our first freestanding day surgery or standalone day surgery occurred in 1982 in Australia. In 2011 to 2012, according to the Australian Bureau of Statistics, we did have 5.2 million day procedures. I must stress, though, that data is very difficult to get in Australia, and so I can only present what is actually publicly available via the ABS. Of those procedures, you can see some public, some private. The majority of them are elective. There are some emergency and 17% of other. The most common day procedures in Australia are the cataract surgery. We had 173,000 cataract procedures in 2011-2012. Plastic and cosmetic surgery in the registered centres, endoscopy, and then general. Again, unfortunately, Australia has not been able to be involved in Klaus's work with looking at comparing baskets of procedures because, again, unfortunately, Australia, we just cannot get the information. 3.7% of Australians' gross domestic product is spent on health, and that equates to about 1,721 euros or $2,181. The Consumer Price Index for health has increased by 4.2%, whereas our Consumer Price Index for overall in Australia is only 1.6, and that certainly impacted us in our facilities because the increases in funding hasn't kept up with the CPI for health. They tend to look at this general CPI. In Australia, 55% have private health insurance as of June 2012. That's actually been a decrease since last time I reported a couple of years ago. The incentive for us to have private health insurance has decreased. The government gives us a rebate on our Medicare levy if we have private health insurance, but the eligibility for that has actually got tougher. So we are finding that there's a decrease in health insurance. It becomes a vicious circle for us in Australia. The less people that have private health insurance, the more the private health insurance levies go up. The more they go up, the less people take it, and so on. So it's certainly one of our challenges. Funding for public hospitals in Australia, again, a little bit complicated. Australia is a Commonwealth. We have states and territories. We have government at the Commonwealth level, then we have states and territories. And so funding comes from various areas. So 52% of our funding for the public hospital is from the Commonwealth, which is our Medicare, and then 37% from our states and territories. If you have private health insurance and you are admitted to a public hospital in Australia, then in fact your private health insurance will contribute. The government likes that. And Department of Veteran Affairs, who look after our armed forces. In contrast, for the private sector, you'll see that 45% is actually the health insurance funds. And again, we've got Veteran Affairs money because a number of private facilities have contracts to provide care for the forces and their family. But you'll see that 13% are individuals. So they're people that are actually self-insured or are just paying. They may be people that have opted not to have health insurance because they've worked out over their lifetime. They're hoping that they spend less money on health than what they would have spent on their private insurance. Or in fact, the waiting list in the public system is so large that they've opted to take out a loan or pay up front. Now, the National Safety and Quality Health Service Standards. This has been the greatest change and challenge to day surgery in Australia in the last 2 years since last I spoke. The Australian Commission on Safety and Quality in Healthcare was formed in 2003 with the previous government, and it's continued with our current government. And we have an election later on this year. It will be interesting to see what happens with that. However, the leader of the opposition was the Health Minister at the time when the Commission was first formed. These standards were signed off by the Commonwealth and/or state and territory at the same time in August 2010, which was really quite amazing for anything to have that sort of level of agreement between the Commonwealth, states and territories. We all knew that they were coming, but we didn't really believe it would actually happen. And there are a number of us in the audience, Australians, who are feeling the pain of these standards at the moment. Consultation for these standards were not available until October 2011. So the standards came in 2010, but we didn't know how they were going to be interpreted in our day procedure centres. In October 2011, they were put out for consultation, the guide of how to interpret them. They were finalised in October 2012 and they were effective for January 2013. So we've had a very short time between what we were finally told and what's actually happened. There are 10 standards and they cover governance, patient-centred care, infection prevention and control, medication safety, patient identification and correct procedure, clinical handover, blood and blood products, pressure injuries, clinical deterioration and falls. And of those standards, there are 256 action items, some of which are considered to be not applicable for day surgery setting, and 47 of those have been deemed developmental until 2015. So that does give us some time to actually work towards them. We don't have to have compliance with those developmental at the moment. These standards are applicable for all 1,345 hospitals across Australia. 71% of these hospitals have less than 50 beds and therefore may not have the support mechanisms to be able to implement these standards in such a short time. And standalone day surgery centres have even less resources. 100% compliance for the applicable action items within 120 days or lose accreditation. And this has major implications for the standalone day surgery centres. No accreditation results in not being registered as a day hospital with the Commonwealth Government, which means no Medicare funding and loss of health fund contracts. So I guess the question that a lot of us are talking and thinking about, and if you hear any of the Australians standing around at any of the breaks, you're probably hearing them talking about the standards. And the questions that a lot of us are thinking about: do we need these standards in day surgery? Are the issues with safety in Australia are there issues in safety in the day surgery centres, as well as our large overnight private and public facilities? Why do we have concerns about what this means for our day surgery facilities in the future? Historically, the growth in day surgery has been because it's been less paperwork, less red tape, more streamlined accreditation, more efficient, and better outcomes. And we've heard about this from various presentations during the Congress about just how we can do things better, smarter, and still with even better outcomes than a lot of our overnight facilities. But small centres are reporting costs of up to $20,000, and I've actually heard this week maybe $30,000 to $40,000 Australian dollars to actually set up and meet these required actions. And much of this is involved in writing policies and procedures, auditing, conducting competencies for things that we're already doing. And I guess a really good example is the falls. We've got a whole standard on prevention of falls, and all of us would agree that that is absolutely what we need to do. But so many of us just intuitively, as nurses, just know that when the patient has had an anaesthetic, IV sedation or general, that they are a falls risk. So we automatically supervise them as they get up off the trolley. We automatically tell them to be careful when they bend over. All these things that we just do because we are good, experienced day hospital nurses. Now we need to write policies and procedures, competencies, audit, and so on. And that's just one example of the many things that good, experienced day hospital nurses in Australia are doing very well. The many benefits of opening and running a day surgery centre are now disappearing because of the amount of work. And as Arnie said, with the physicians owning hospitals, a lot of our day hospitals in Australia are owned by doctors, and again, we're allowed to do that. They just need to declare that they have a financial interest. And a lot of them did that to get out of the complicated red tape of the larger private hospitals, and went and built and invested a lot of money into these standalone centres so they could provide efficient and excellent care. There are a number of day hospitals or day surgeries already to date, so we're only in May 2013, 5 months into these new standards, who are currently in that 120-day period to address the action items that have not yet been met. They will lose funding if they're not accredited. They may need to close. Those of us who are involved in auditing on behalf of the Commission are yet to see what will happen when they do not grant satisfactory met at the end of that 120-day period. Will the facility appeal? Will the facility try and sue for loss of business? Or will the Commission review the requirements needed for day surgery facilities to meet these standards? So what does this mean for ambulatory surgery in Australia? Will we go back to overnight facilities as integrated wards rather than have standalone day surgeries? Will the day surgeries be bought out by large organisations so that they can tap into the resources of the larger organisations? And finally, will our patients be any safer? So, in conclusion, watch this space. Only time will tell. Feel free to email me on my council email, and thank you very much for your attention.
Thank you, Wendy. Thank you so much.
May I just have one little advertisement that all the Australians that are here, we're having a photo shoot here at the end in morning tea so that we can pop it in our journal, include it in our tax returns, to say that we were in Budapest in May 2013. Thank you.
Thank you.